We often hear about hyperbaric oxygen therapy, boosting healing for things like stubborn wounds, right?
Right, like diabetic ulcers and things like that. Standard stuff.
Exactly. But here's something really fascinating. What if this treatment, breathing pure oxygen in, a pressurized room, could actually have surprising effects on our body's hormones?
Ah, the endocrine system connection.
Yeah, we're going to dive into that today, looking at the links between hyperbaric oxygen, or HBO, and our endocrine system. And this is all based on some pretty compelling scientific research you shared.
It is. We've got a good collection of studies here.
So our mission really is to explore these less obvious interactions. How might HBO affect, say, your thyroid or your stress hormones?
It's a great question because HBO essentially floods your system with oxygen under pressure. We know it helps oxygen-starved tissues, that's clear.
But these knock-on effects on the endocrine glands, the
Yeah.
hormone regulators, that's the really interesting part we want to unpack.
Absolutely. It suggests these high oxygen levels might do more than just heal wounds. So where should we start? Thyroid, maybe? It's a familiar one for many.
Okay, yeah, let's start with the thyroid. It seems like the early research, mostly animal studies, was a bit, well, confusing.
Uh-huh. A little bit contradictory.
Like there's one from way back, 1964, on rats. High-pressure oxygen made their thyroid glands smaller by weight.
Right.
But, and this is the twist, the same study found these glands took up more radioactive iodine, which sort of suggests, well, increased activity, right?
Precisely. It's a bit of a puzzle. It hints that maybe the size isn't the whole story. The function, the iodine uptake, might be changing differently, maybe boosting hormone production activity, even if the gland shrinks slightly.
Interesting. So size versus function.
Exactly. But then when we look at the later human studies, especially the ones out of the USSR, the picture gets a bit clearer, maybe more consistent.
Ah, yes, those studies. Our sources mention quite a few. It seems like HBO treatment, usually around, what, 2 atmospheres?
Yeah, 2 ATA, typically, twice normal sea level pressure.
For about an hour a day, maybe 10, 12 days. It seemed to help normalize thyroid hormone levels.
That's the key finding, normalization, both in healthy people and in those with overactive thyroids, thyrotoxicosis.
And apparently the effect lasted for a decent while, too. Like a month, month and a half.
That's what was reported, yeah. Which is pretty significant. It suggests HBO might be having some kind of regulatory effect, pushing things back towards baseline, whether they started high or low.
And they even used it for patients with really severe overactive thyroids, diffuse toxic goiter, before surgery.
They did, as a preoperative prep. Shorter sessions, 45 to 60 minutes, maybe 6 to 10 days, carefully adjusting the pressure.
And the benefits.
Well, they saw less tachycardia, that racing heart feeling,
Okay.
less overall blood volume, better heart muscle contraction, and critically, no increase in thyroid hormones, which is always a worry in that situation.
Right, you don't want to make it worse before surgery.
Exactly. And it apparently shortened the whole pre-op preparation time by 8 or 10 days.
Wow, that's a practical benefit right there. And it didn't stop there. They used it for post-surgery crises, too.
Yes, managing those thyrotoxic crises. And there was even some suggestion that pre-op HBO might lead to lower recurrence rates of the goiter later on.
Okay, so it seems like the extra oxygen might help stabilize the thyroid somehow.
That seems to be the implication from these studies. But, like our source material rightly notes, there's still some controversy. We definitely need more research to nail this down.
Agreed. Promising signals from these human studies,
Yeah.
but we need bigger, more controlled trials, for sure. Okay, let's shift gears. What about other hormonal players,
Author.
like glucocorticoid receptors?
Right. Glucocorticoids think cortisol involved in stress, metabolism, immune response.
Very important stuff.
There was an animal study, rats again, a single, pretty intense HBO session 3 atmospheres for 5 hours.
That sounds like a lot.
It is, and they found it cut the number of glucocorticoid receptors in the rat's lungs by about half. Temporarily?
I like temporarily.
Yeah. Within 24 hours, the receptor levels bounced back up. Interestingly, their blood cortisol levels were lower than immediately after the exposure, but still a bit above the normal baseline.
So, intense oxygen knocks down the receptors, maybe as a protective thing in the lungs, but then the system readjusts.
That seems to be the idea. A temporary downregulation, maybe to protect against the high oxygen, followed by the body trying to find its balance again. It hints that HBO could influence how we respond to stress at a cellular level, especially in tissues getting a lot of that extra oxygen.
Interesting. Okay, what about the adrenal glands themselves, sitting on top of the kidneys, making
Yeah.
those stress hormones?
Right. Well, another animal study, less intense this time, 2 ATA, 90 minutes a day actually seemed to increase adrenocortical function in rats.
So the opposite effect with regular, less intense exposure.
Kind of points that way. And it lines up somewhat with a study on human athletes. They did daily HBO, an hour at 2.8 ATA for 10 days.
And what happened there?
What's really interesting is the timing. Day 1. A big jump in ACTH, that's the hormone telling the adrenals to make cortisol.
Okay, an initial spike.
But then over the next, say, 5 to 10 days, those ACTH levels stabilized. They didn't stay high.
So like an initial wake-up call followed by the system adapting.
Exactly. Adaptation seems key. And this led the researchers in our source to speculate, could HBO help people taper off long-term steroid drugs? For things like arthritis.
Because it might help kickstart their own adrenal glands again.
That's the potential idea, a very hopeful thought for people stuck on steroids.
Yeah, definitely. But then context matters, right? There was another study, rabbits with brain injuries.
Right, blast-induced brain injuries. And in that specific case, early HBO treatment seemed to reduce ACTH expression in the pituitary gland, along with another marker, aquaporin-4.
So in that context, it suppressed the stress hormone signal.
It suggests that yes, maybe dampening that initial inflammatory or stress surge after injury, it really shows how the effect might depend heavily on the underlying condition.
Makes sense. Okay, let's talk about the classic stress hormones, epinephrine and norepinephrine, adrenaline and noradrenaline.
There was one study looking at men in different oxygen environments. They found the ratio of norepinephrine to epinephrine changed directly with the oxygen levels. Went from like 2.1 up to 6.1.
That's a big shift in the balance. And they have different effects on blood flow, don't they?
They do, somewhat opposing effects generally. Norepinephrine tends to constrict blood vessels. Epinephrine can dilate or constrict depending on the dose. So changing that balance via oxygen levels, like with HBO, could definitely impact circulation.
But then another study, this time on hypertensive rats. HBO at 2 ATA actually increased both epinephrine and norepinephrine in their adrenal glands.
Yeah, that seems a bit counterintuitive if you're thinking about high blood pressure.
Right.
Raises questions. And the source also mentions the known link between these catecholamines and oxygen toxicity risk under certain high-pressure conditions. So high levels could be problematic sometimes. However, complicating things further, a study on divers at similar pressures didn't find a big generalized hormonal stress response. They did see an increase in endothelin-1, though, which also constricts blood vessels.
So it's not always a simple stress on or stress off situation. It's nuanced.
Very nuanced. And then there's the high-altitude study.
Oh, yeah, that was fascinating. Using HBO before going to high altitude.
Exactly. Pre-treating people with HBO before they went up to 4,000 meters actually raised their plasma levels of dopamine, epinephrine, norepinephrine, and ACTH.
To help them adapt faster to the low oxygen up there.
That was the idea. Priming the system, perhaps. Using high oxygen to prepare for low oxygen. Pretty clever.
It really is. Okay, let's move on to prostaglandins. They're involved in all sorts of things, right? Inflammation, pain.
Yeah, very diverse roles. One study in dogs using HBO showed decreased blood flow to the kidneys, less urine output, and specifically a drop in urinary prostaglandin E2, or PGE2.
But the hormone that usually controls urine output, ADH, didn't change.
Correct. Antidiuretic hormone levels stayed the same. So the researchers thought maybe the reduced PGE2 was either changing blood flow patterns within the kidney or perhaps making the kidney more sensitive to the ADH that was already there.
Interesting. So influencing fluid balance potentially through these prostaglandins.
Seems possible.
Yeah.
And we see other effects too. A study on rat brains found even mild hyperoxia reduced a certain prostaglandin metabolite.
Okay.
But then in humans with gastric ulcers, HBO seemed to restore PGE levels that have been lowered by certain ulcer medications.
So it can go both ways depending on the situation. Lowering it here, restoring it there.
It looks that way, very context-dependent. We see that again in periodontitis gum disease. An animal model showed HBO at 2.5 ATA reduced the high PGE2 levels found in the inflamed gums and bone.
Suggesting an anti-inflammatory effect in that specific case.
Precisely. And one more on prostaglandins, a study on fever in rabbits.
Using oxygen to fight fever.
Apparently, HBO, given before or during the fever, could suppress it. The theory involves interrupting a pathway in the brain involving glutamate, damaging free radicals, and, again, PGE2. Adding an antioxidant alongside HBO made the effect even stronger.
Wow. That's really working on inflammation at a fundamental level in the brain.
It suggests that, yes, potential modulation of central nervous system inflammation pathways. Okay, maybe a quick word on testosterone.
Right. Some studies, animal ones and human divers at high pressure, did show a decrease in testosterone. That might worry some people.
It might. But the key thing our source highlights is this. Studies using daily HBO exposure, similar to what's done clinically, 2 to 3 ATA for 90 minutes or so, found no significant changes in testosterone levels in rats.
Ah, so the typical therapeutic doses might be okay in that regard.
That seems to be the finding, which is reassuring for clinical use.
Good to clarify. Okay, now let's get to what our source really emphasizes as a major potential clinical area in endocrinology for HBO beyond wound healing diabetes.
Yes, diabetes mellitus. Interestingly, not many animal studies on induced diabetes mention, but quite a lot on human patients.
And sounds promising.
Potentially very promising. There are reports of improvements in cardiovascular complications for diabetics getting HBO.
Okay.
And when used alongside diet and insulin for moderate diabetes, it often allowed patients to reduce their insulin dose.
Reduce insulin. How? What's the thinking there?
Several ideas proposed. Maybe HBO inhibits hormones that work against insulin. Maybe it boosts the body's own insulin production. They saw increased C-peptide. Or maybe it improves how sensitive tissues are to insulin, possibly by helping correct acid-base balance.
Okay, multiple potential mechanisms. That's significant.
And the benefits seemed broader, too. Better overall carbohydrate metabolism, better energy production in tissues at the cellular level, and reports of helping with common diabetes complications, nerve damage, blood vessel problems, tissue breakdown.
The neuropathy, angiopathy, trophic changes. HBO seemed to help.
That's what these studies suggested, yeah. Even patients getting HBO for diabetic ulcers showed reduced insulin needs sometimes, suggesting a whole body effect on glucose control.
Right, not just local healing.
Exactly. Better circulation in the legs, better general condition reported in male diabetics, leading to recommendations for repeat courses of therapy. There's even a rationale mentioned for using it in stroke patients who also have high blood sugar.
And it doesn't stop there. Islet transplantation. Autoimmune diabetes.
Yeah, explored as an adjunct to improve pancreatic islet transplant outcomes. And in an animal model of autoimmune diabetes, like type 1, HBO actually reduced the disease onset. The thinking involves effects on immune cells and protecting the insulin-producing beta cells.
Protecting the beta cells themselves. Wow.
And one more, a study on type 2 diabetes patients, 20 HBO sessions led to improved glucose tolerance. Didn't see that effect in the non-diabetic controls. They even speculated about the carotid bodies, the oxygen sensors in our necks being involved.
Okay, so pulling it all together for diabetes, it really looks like HBO could be a useful tool.
A logical adjunct, as the source puts it. They mention seeing blood glucose drops even in healthy volunteers getting HBO.
Which leads to a really important practical point.
Absolutely critical. If a diabetic patient is getting HBO for any reason, a wound, whatever, you have to monitor their blood sugar closely because their insulin needs might actually go down.
Need to avoid hypoglycemia.
Precisely. There is apparently even a calculation method developed to help estimate how HBO might impact insulin requirements.
So careful supervision is key.
Vital. But the range of potential benefits, improving insulin sensitivity, maybe protecting beta cells, helping with complications, it really makes a strong case for more focused, large-scale research on HBO, specifically for diabetes management.
Well, this has been quite the exploration. We've really seen how hyperbaric oxygen seems to touch on so many parts of the endocrine system.
It really has. From the thyroid findings, however tentative some might be.
Right, to the adrenal function, the stress hormones.
The prostaglandins involved in inflammation, and then this really significant potential role in diabetes. It's quite a range.
It's pretty amazing, really, when you think about it, that just breathing concentrated oxygen under pressure could have these kinds of effects on our hormones, way beyond just wound healing.
It is striking. It underscores how interconnected everything is. Changing one variable, oxygen availability, can ripple through these complex regulatory systems.
Absolutely. And yeah, like we said, some areas definitely need more solid research, especially things like the thyroid effects, need those big human trials.
For sure. Much of this is still suggestive rather than definitive.
But the possibilities are just, well, really intriguing.
Which leads to a final thought, maybe for you listening. If HBO, a therapy we thought we understood, has these potential hidden endocrine benefits, what other treatments out there, maybe things used for totally different reasons, might have undiscovered effects on other body systems?
Yeah. It makes you think about how Treatments designed for one thing could have these unexpected, maybe even beneficial side effects elsewhere in the body.
Exactly, that interconnectedness, how targeting one pathway might influence others in ways we haven't even considered yet. Something to ponder.